I found this great book. It's through a mutual friend. It's a long story, but the book is called The Autoimmune Brain. And the byline here is a 5-step plan. Stay with me on this, please. A 5-step plan for treating chronic pain, depression, anxiety, fatigue, and attention disorders. And it's from David Younger, who's a neurologist. And I know Dr. Younger. We've been at events together. He wrote I got the call yesterday from a friend, Joe. Dr. Younger's doing a book signing at Barnes & Noble. That's where I was in the Upper West Side last night. So many people came out. This is so fascinating. It's how the brain works and how he has saved so many people who didn't know what was wrong with them. So Dr. Younger is calling in now. Dr. Younger, thanks for calling into the show. How are you doing this morning?
Good morning, Joe. Thank you very much for having me on the show.
It was so great last night. You were great last night. In front of that audience, you explained everything and what you do. First of all, tell us what you do and what you have done as a neurologist and how it affects everyday people and all the people that you help, Dr. Younger.
Well, what I try to do is be an intermediary between people's physical and emotional suffering and the struggles they have with what I would say is the existential dread and exhaustion of not knowing what's wrong with them, not being believed, not finding relief, and trying to help them find an answer within their nervous system for the cause of their complaints.
Look, tell us about that. Was so great. You know what we did at this, guys? I'm talking to Frank and Al here, and to you listening and watching. We had a girl named Lucy came up and told us what she went through. Doc, I gotta say, Doc, that was so moving. She didn't know what she had. She was on pretty much addicted to opioid. Walk us through Lucy's story, if you would, sir.
Well, Lucy was a young 30s. Person who was exercising extensively. She was experiencing, the best things in life up until a time when she developed pain, and pain became her nemesis. Imagine that, a new mother with a 2-year-old and an 8-month-old unable to breastfeed, in pain, losing her health and her mental integrity. In short, she developed OCD, depression, loss of self-esteem. All of her negative thoughts and actions led her to a variety of doctors, hospitalizations. She was offered opioids. She was offered no good direction for recovery. So imagine a new mother or analogously a college student or a young adult who loses their health and integrity and then is on a downward spiral. No one's believing her. No one's offering her the path forward.
So she didn't know what she had. She just had, and then you found out what it was. And correct me if I'm wrong, it was Lyme, correct?
Exactly. What we did is we did an extensive evaluation. She came right from the hospital to my office, and we led her down the simple track of being able to examine her nervous system in very great detail. It only took about 2 hours. We did a lot of extensive tests in the office. We found out that she had a painful peripheral neuropathy. We found out that she had an autonomic disturbance, so she couldn't feel the changes in her vital signs. Her anxiety was a manifestation of her heart rate out of control.
Wow.
And then we found out that, in fact, her neuropsychiatric illness, her depression, OCD, were due to brain changes themselves.
Wow. So how do you treat something like that? I mean, do you have to give, because she got a lot of drugs, so you had to pull her off of all those drugs, correct?
This is the task of someone who can patiently listen to the story of how she arrived at her present situation. What we did is we sort of turned back the film on her to the very start, when she was first bitten by a tick, when she first experienced what everyone else missed, which was the trigger of her disease. And so that had been glossed over time. And what we did is we started her on antibiotics, doxycycline, 200 milligrams a day.
Wow.
And then we followed that with an admission to the hospital, where someone looked at her psychodynamics, offered her psychotherapy, offered her an antidepressant, gave her comfort and support, and then we initiated immune modulatory therapy with intravenous immune globulin, which she took monthly for about 9 months. And to this day, she's now normal.
Well, God bless you for that. We're talking to Dr. Younger, Dr. David Younger. The name of the book is right here, The Autoimmune Brain, and it is fascinating. I'm not. Look, I'll full transparency. Like I said at this gathering that we had yesterday, which was great for your book signing, sir. I'm a hypochondriac. They told me I had cancer in 1981. I worry about everything. I really do. You know, it's why. So I was so immersed in what you wrote, Dr. Younger, Dr. David Younger. I'm holding up the book. It's called The Autoimmune Brain. And before we let you go, Doctor, we appreciate you jumping on the air with us because this is fascinating. What are some of the things we can do right now to recognize, prevent, and treat problems that arise from autoimmune disease?
Well, in my book, you'll find the 5 steps, which is the name of the book. The first one is to test for the most likely autoimmune process that's affecting your brain health. That's the T. The A is applying immune modulatory IG therapy under a physician's care to address both the immune response and the changes to brain health. The P for TAPES is participate in the most effective behavioral and therapeutic options to reduce stress and fatigue, anxiety, depression, and memory loss. 4 is the E, eating and exercise, both very important to restore your brain health, alleviate pain, enhance the immune system. And the S, survey your home and environment for chemical exposures, remove mold, heavy metals, and any other potential allergens that can stand in the way of full recovery.
This is great stuff. Dr. Younger, I tell you, this is a landmark publication. It's called The Autoimmune Brain, and our mutual friend, Mr. Mira, said, you got to talk to Dr. Younger about this because it is vital, and I knew our folks who listen will be so interested in this. Thanks. I'll see you soon, Dr. Younger. God bless. Congratulations on the great book, and let's talk again soon. Anytime, you're welcome on the show, sir.
Thanks, Joe. I look forward to coming on the show.
Thank you, David. David Younger, right there. He's a neurologist. The Autoimmune Brain is the name of the book.